could you tell me a little bit about yourself, your shoulder, and kind of where you were at before we started working together, and especially getting into kind of the tennis side of things and how it was affecting you?
So I used to play tennis, and I had an injury while serving. So I had terrible pain when I do a lot of strength movements, strength exercises here in this part of the shoulder, and I didn't feel enough strength, enough mobility to do that. And I think with this program, it helped me a lot to get more mobility in the movement and more strength. Yeah, I
Okay.
think 3 4 months I improved a lot.
Tell me a little bit about kind of like what led you to go to a more of a virtual shoulder specialist rather than just going to one of your local physiotherapists.
Uh, because I tried two physiotherapies here where I live, but then I did 10, 20 session, and it's done. I didn't get any help after that, so I needed to do the exercises for myself, and I think it's important to have a plan to the exercises day by day, because for if we don't have a plan, we can skip and forget about the exercise, and then it's important. It's very helpful to have it in our phone, just one click away, to have all the exercises. And if I had any doubts on how to do the exercises, I can see the coaches doing that, so it's pretty great.
Nice. And that was gonna be kind of one of my next questions was, what that process of working remotely was like.
I think it's very important to do like once a month, one time per 2 weeks or something. It's important. So it's important for you and for me to have the feedback
Yeah.
to see where the things are going. Yeah.
Exactly. All right, and then can you maybe talk a little bit more about the specific improvements that you noticed, throughout? And so, early on, right, it was really painful to do some movements, and then as you kept going, maybe expand on kind of how things changed throughout the periods.
Yeah, so when I get this injury, I had a lack of mobility. If I do movements upside the shoulder or something, it hurt me a lot. I didn't feel had any mobility at all. If I do like very angular movements with wide angles, it hurt immediately. But with the exercises, I improve my mobility a lot. The first step was the mobility that I really needed, and the last step was the strength, that it's important.
What would you tell someone who is hesitant about starting this virtual shoulder rehab program?
The first contact, we are not so sure, because it's you are very far away from me. It's from distance, so we are not so sure, because I was used to, at the gym, talk to my personal trainer, and at the physiotherapy they touch the part of our body that when I went back to the gym, if I had any difficulty with an exercises, I watch the videos, and even in the app, we can film ourselves, and you say if I'm doing the things right or not, and we do a chat or something. So yeah, even at distance, I felt that we were not so far away and always in touch, so it was great.
With this kind of platform, like it does allow you to literally contact me anytime that you need to. And so you have just way more time for me to kind of help you out.
Some physiotherapists, when I go there in person, they spend a lot of time with massages and not so much in exercises. Want to thank you, Cooper, for all the help. In the shoulder, I feel more confident day by day. Thank you for all your time and all these past months. It was really great. As I said before, I feel that the feedback from my side, from your side, was really important.